All right, everybody, welcome back. We're going to show you another video today. It's a modification of something we did previously on the same subject for improving abduction of the AC joint. If you remember, or if you want to go back and look, last time I had my palpating hand or stabilizing hand along the distal clavicle. The other side was actually trying to approximate the inferior glenoid to bring the two surfaces together to help abduction of the AC joint. And I believe we did your left side last time, at least from what I remember, hopefully. And what we're going to do today is opposite side is right side. So it's going to be different. I'll show you what it's going to look like on the model, but just to see the differences on him, his left side, not too bad. Right side, that's about all he's got. And what I'm feeling for is feeling when his shoulder starts to come up and loses that nice range where his scapula has to start elevating because the movement isn't there at his AC joint. So here, if you can lie on your back, what we're going to do instead of what we did last time is actually, and this works great because this is the right shoulder, is I'm going to hold his distal clavicle similar to what we did before, but I'm going to help position his arm, and I'm actually going to grasp along the inferior angle here and pull it laterally this way to help actually abduct the scapula relative to the clavicle. So that's what we're going to do, and this is what it's going to look like. So a couple of times, well, many times when I've done this, I'll have the arm this way to trap it and make sure that I have control over it. Sometimes those we're doing this, they start to get a little nervy or tingly in the hand, so I'll either have them bend their elbow up over my shoulder like that, or I can just support their shoulder like this on my upper abdomen or something. They can have their hand on their head and just trying to relax their arm that way. But here, you can come around, maybe see a little differently. Thank you, sir. I'm going to have my key grip right along the distal clavicle like that. I'm going to bring his arm basically up to where he's kind of limited, which is here. If he needs to, he can still support his hand on his forehead. And then I reach and grasp at his lateral, or excuse me, his inferior angle of his scapula there. You feel that? Mm-hmm. Okay. So next thing I'm going to do is try and grasp that and pull it laterally out this way. And when somebody has a stiff AC joint with this, it's not going to feel like it moves very much, obviously. It's stiff. But kind of hard to do any kind of contracting and relaxing at this particular part of his body. So what I'll have to do is just kind of give pressure, take up as much motion as I can between my two hands, and then relax it there. So he's going to completely rest his elbow on me, take that movement, pull laterally. It's kind of tough if the person you're doing this on has a scapula that is really glued to their rib cage to actually get a purchase on that corner of the scapula. If somebody has a scapula that kind of sits off their rib cage, it's a little bit easier to grasp it and pull onto it. And it helps to have halfway decent grip strength to do this. But as we do that, each time we go, should be able to feel an increase in movement. What does that feel like to you?
A lot of pressure.
A lot of pressure. Good. So that is what we're going to be working on. Just to show you the other thing, I could be supporting his arm like this, still grasping along here, and then pulling around this way. If he needs to, go ahead and bend your elbow for me. He can do that. Lift your arm up a little higher there. Good. So I can still have control over it, but it's just taking some of that tension out that way. And that's able to really get a lot more movement. Mm-hmm. For whatever reason on him. That's very helpful. So I can still play around with the position of his arm, really pulling out on that scapula that way. So that's just a quick demonstration of it. Go ahead and sit back up for me. So I want to see if that's any different. relaxed again. And again, quite a lot of difference on him to go from about 90 degrees up to almost full abduction. So it's one of those things that you have to play with a little bit to get used to it. Really getting the grasp of the inferior angle of the scapula and pulling it around the rib cage as you're stabilizing at that distal clavicle. But I think it's a nice alternative. In some ways, I think it's even better than what we did before, more effective wise. So give it a chance, give it a try, and see what you think. Leave a comment or review on YouTube or anything else like that you guys can. Let me know how it works. Hopefully, it works out well for you. If not, if you can improve it somehow, then let us know that too. We all learn that way. So thanks a lot. Catch us next time on the next video.